The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Good evening. Welcome to yet another episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. I am Jessila Mujib. Good health is a journey, not a destination. In this talk show, in each episode, we bring before you an expert doctor from Al Hilal Hospital to discuss your various health issues to guide you in your journey towards good health. Sinusitis is a common illness these days. To discuss this subject in detail, we have with us Dr. Thiru from Al Hilal Hospital, Sitra. He is an expert ENT surgeon with an experience of over 11 years. So, to throw more light to the topic, let's move on to him. So, doctor, welcome to the show and thank you for joining us today.
Thank you, ma'am. So am I.
So, doctor, many people complain about sinusitis. So, what is this condition and how common is it these days?
Okay. So, before I explain about the condition called sinusitis, I will explain what are sinuses, ma'am. Our head, that is the skull bone, is basically a heavy one because it has even the brain lodged in it. So, to make it light, God naturally created with empty spaces in the skull which are filled with air so that the skull is light. So, there are 4 groups of these sinuses, these empty spaces. 2 above the eyes, below the eyes, between the eyes and behind the nose. They are frontal, maxillary, ethmoidal and sphenoidal sinuses. So, this is there that when you breathe in and breathe out, the air circulates through them and then goes to the lungs and comes out. By that, it aerates all the empty spaces and keeps the sinuses and the head and neck, everything healthy. So when there is, and one more thing is there are 3 finger-like projections coming from both sides of the nose. So they act like again filters, which filters the dust, viruses and all like that. And in such attempts, sometimes the tissues become enlarged and they also can clog on to the opening for the sinuses. And also if there is deviated nasal septum, that is this middle bone may sometimes be deviated, that also may sometimes cause obstruction. So in these conditions, when the inlet of the sinuses are blocked, the phlegm or the mucus that is secreted from the mucosal surface will get clogged inside itself, and that becomes a very good media for the virus and bacteria to grow, and that causes severe inflammation and infection and pain, and patients present with running nose, sneezing, a nose block and severe pain on the face and the head, and those areas may even become swollen. So this inflammation of the natural sinuses is called sinusitis, ma'am.
And how common is it?
Yeah. As we are living in this world full of microorganisms and dust and everything in this air, our natural immunity only is protecting us not getting sick with all these things. But when our natural immunity comes less, and our food habits, because of this the development of the world where you go more in for this fast food items, carbonated drinks and everything, that reduces the natural immunity that is there from us from birth. So then the microorganisms and these allergens and bacteria, they all win over our immunity, and that's how we start getting the infection. So as nose is the first thing which comes in contact with all these things, they start developing the allergy symptoms, causing the secretions and everything, and developing into the sinusitis. So that's what, ma'am. So it's almost in my daily OPD, around more than 60% of the patients are having in one way or the other problems which are related to the sinuses. So that's pretty common thing, and especially it is more common during this cold seasons, the winter. Right now we have when we are in the winter season of in Bahrain, so I get more and more of such patients these days.
So doctor, can you explain the symptoms of sinusitis in detail for our viewers?
Yeah. So starting with, you will have the patients will have watery to thin mucus secretions to even thick mucus secretions from the nose, either from the front or at the back side of your throat, which may cause irritation of the throat and cough. Second is nose block. So the patient will have difficulty in breathing. It initially starts at the night time, mostly like that, and sometimes if the disease aggravates, they'll have even nose block even the daytime also. Naturally, one nose will close and one more nose will open as a alternative basis. That is normal, but that becomes more problematic in such allergic conditions and sinusitis conditions. Then comes the facial pain. The regions of that sinuses will get inflamed and they will have pain over there. If you press also, they will have severe tenderness and the headache also, and there may be even swelling of that areas when the infection is active, and they will also have disturbance with their smell sensation, and even the food may not be tasty, because if you get this good smell only, you can appreciate the taste also. So patients will have this sort of problems.
Now the symptoms you told are similar to the symptoms of common cold and also of COVID sometimes. So how can we diagnose sinusitis from the other things?
Okay, ma'am. The difference between the flu and the sinusitis is they just present only for 7 days. Whether you take a treatment or not, whether you take medication or not, you will be relieved of the symptoms within some 7 days. So that is called common cold or flu, the normal flu. Whereas sinusitis will at least be for since from 2 weeks to, it can be even for 12 weeks or even more. So whereas COVID doesn't have any special symptoms for itself. It is almost like the same flu and sinusitis symptoms. So you can't just differentiate a COVID patient from a normal like allergic rhinitis or sinusitis patient, because if suppose I say, so we call randomly 10 people and ask them to stand there and we ask who is diabetes in this, can you find out, means we can't find out. The blood test you do for everybody, those people who have high abnormal levels of sugar, they will be labeled as diabetes, whereas the other people will be normal. Just like that, you do that PCR test or the rapid test for the COVID, for the suspected patients. If they are positive, they are COVID positive. If not, they are the regular flu patients. They're like that only. So nothing to worry about. Now that the COVID is much controlled and the people are all vaccinated, so but here still now I'm finding my patients telling that, sir, I'm having this cold for the last 2-3 days. My office people are telling, first go take the treatment, they isolate me, so that's creating a lot of problems because they are all afraid about this COVID thing. So really nothing to worry about it. This simple test of that COVID test will exclude those patients, and otherwise it is just like a common thing, because allergic rhinitis, common flu, they're all like years, thousands of years we've seen in our common public, so nothing to worry about it. So this is what the difference, ma'am.
Okay, so what are the tests to be done to find out a person is having sinusitis?
To start with, a basic blood test, which is where we give complete blood count, where the WBC count will be or may be elevated. The eosinophil counts can be elevated in case of more of allergic nature, and then the sugar levels we have to be found out, because a patient who has high levels of sugar, even a small infection will come like a big infection, whereas if the sugar levels are correct, even a big infection will go like a small infection. So assessing the sugar condition of each and every patient is also mandatory. And then next is going for X-rays. X-ray of the paranasal sinuses. That will show whether there is any significant infection or inflammation there, any fluid level is there. That all can be assessed, and if there is any significant finding of the sinusitis, next will be like nasal endoscopy, where you can visualize the nasal cavity and the entrance of that sinuses, where if there is thick mucus discharge seen in the endoscopy finding, that it goes more in favor of sinusitis. You may even see polyps in the nasal endoscopy. And as I said, the last definitive investigation is a CT scan. CT scan of the paranasal sinuses will clearly tell what are the sinuses involved in this, how much is the infection, presence of a polypoidal mass, and that also decides what should be the treatment. Is it medical or surgical? That's the fact.
So now you mentioned about the nasal polyps. Can you explain in detail what are nasal polyps?
Okay. The nasal polyps are basically a hypertrophied mucosa actually. So they are abnormal tissue only. In patients with these symptoms of more of allergic rhinitis or sinusitis, the mucosa that I told in the sinuses, they become inflamed, enlarged, edematous, and they fill the sinus, and then they might even protrude through the windows, or we call them ostium, and through that they will come to the nasal cavity and cause obstruction, mechanical obstruction, where the patient will find difficult to breathe through the nose. If symptoms are aggravating, or if the disease is aggravating more, it will even cause obstruction even in the daytime, and they will be literally mouth breathing only most of the time, and it will cause secretions and discharge and cause so much of difficulty for a social life itself. So basically, again, in polyps there are two types of polyps. Bilateral ethmoidal polyposis is there. The other one is anteroconal polyp. Bilateral ethmoidal polyposis is more of allergic cause, and it will involve both sides of the sinuses. So bilaterally, both sides, you may find thick polyps which are coming to the anterior part, like the front part of the nose. You do from the nose, we say anterior rhinoscopy. There itself you will see the polyps and all. Whereas anteroconal polyp will be only on one side of one side it will involve. And again, treatment wise, surgically you remove it. The bilateral ethmoidal polyps there is chance for recurrence, so doctors will tell even if you remove it, there is chances of again coming. Whereas anteroconal polyp with one surgical intervention itself, very rare.
There's no chance for recurrence.
I won't say no chance, but very rare for a recurrence. So these are the polyps.
Okay. Doctor, what are the different types of sinusitis? Can you explain for our viewers?
Sure. So sinusitis again starts from acute and chronic. These are the basic things. Acute means from 2 weeks to maybe 3 weeks, like that it will last, and maximum is 12 weeks. Within this, if you have the infection of what I explained of sinusitis, it is called as acute sinusitis. If it involves more than 12 weeks and it keeps coming, then it is called chronic sinusitis. And chronic recurrent sinusitis is something that you keep on getting these episodes again and again and again for a long time. year after year, that goes for recurrent chronic sinusitis.
So, doctor, we have a query from one of our viewers. His son is 8 years old and he has a recurrent, as you told, recurrent sinus infection. So, what is your advice for them?
Okay. The treatment and the investigation almost the same like how for adults. But the only difference is the development of the sinuses. By the age of 9 only, the frontal sinus, which is above the eyes, they develop. So, till the age of 9, no need to worry about the frontal sinus. So, in this particular child that you said, most probably it will be with this maxillary
8 years old.
Yeah, 8 years old child. It will be mostly with the maxillary and ethmoidal sinuses only. So, again the investigation is just like how I explained: blood test, nasal endoscopy and X-ray sinus. And if there is anything suggestive or significant finding is there in the sinus, then you go for the CT scan. 80% of the patients, if they are not responding to medical treatment, then surgically they can be corrected and they will feel much better, and recurrence also is much less only. But as I told you in the initial way, even the deviated nasal septum can cause the problem. So, if the child happens to have deviated nasal septum, then the child has to wait till he reaches the age of 16 to 18 years, because till at that age only the complete fusion or formation of the septum completes. So, till then they have to wait. Before that, if they do the surgery, there will be, nose will not give a good shape at all. It will be a cosmetic problem and it is not indicated at all. So, after that they can do the surgery. Otherwise, if the septum is not involved, then any age they can do the surgery. And so, definitely the child has to go for all this proper. Most of them, they just try to go to the counter and take some medicines for sinus, or just basically go to the basic health center. They just give some, for that time they will give some medicine. So, that will not, yes. So, that will just subside at that time, and again they will have aggravated things. So, they should definitely go to a place where with all these investigations is done. And as I told you, just 1 week or 2 weeks can be neglected, but in terms of months and years, if they are coming, definitely they have to go for a proper evaluation, and then only they can, these problems can be settled.
Okay, once we are diagnosed with the sinusitis, what are the treatment options you go for?
Okay, treatment, medical and surgical, we will say, ma'am. So, in medical treatment, first a course of antibiotics will always be advisable, and in ENT we generally say minimum 7 days you have to give. Patients will ask also, doctor, 2 days, 3 days they will ask, that will not help at all. So, minimum 7 days to 2 weeks is needed for a proper sinusitis treatment.
Antibiotics.
Yes, antibiotic treatment. And then depending upon the severity or the chronic, then we may even give for another 4 weeks to 6 weeks antibiotics and all were given, used to be given, but mainly thing is at least 1 week minimum has to be started. Second is anti-allergic medicines. So, anti-allergy medicines plays a vital role because everything starts from the allergy point of view only. Then comes mucolytic agents, that mucus that is blocked in the sinuses, that has to be drained out. So, for that there is medicines to give that mucolytic agents, then mainly the painkillers. All sinusitis patients, the main complaint is pain. Until they have pain, they usually don't go to the doctors. Once the pain becomes unbearable and recurrent, then only they go to the hospital. So pain medication treatment for the pain control is supposed to be started, and then nose drops or sprays are available for the decongestant purpose, because the nose gets congested and the tissues will be enlarged. So by using this decongestant sprays or drops, they will reduce the size, make the patient free to breathe, and then the sinuses also will drain once the congestion reduces. It will be, the opening will be little big, so that the mucus can drain through the front of the nose or back of the nose. So if by medical treatment, if the child is responding or the patient, adult patient is responding, well and good. But if again and again they are having these symptoms and all like that, then with this finding of the CT scan, that will tell whether you need the surgery or not, then the surgical treatment is needed. For that, more commonly done is the functional endoscopic sinus surgery, which there is no scars outside. Straight away through the endoscope, we put the instruments, open the sinuses from inside and drain them, wash them, and that will be the definitive treatment.
Okay. Is there a chance of recurrency after this procedure?
If, see, by this treatment we are eradicating the disease, but if the child or the adult, the patient, if again continues to lead the same lifestyle, not keeping his room tidy, going in the dusty area without any protection, taking too much of cold food stuff and fast food stuff, those things will again give a chance for him to develop these sinusitis. So it is always advisable, definitely they have to do lifestyle changes and take the precautions and all like this, then there is much possibility it will not happen. More often the deviate nasal septum, if that correction alone will not cure the sinusitis problem. So along with the deviate nasal septum, if it is obstructing the sinus opening, the deviated nasal septum correction plus the sinusitis surgery is supposed to be conducted, which will give a better outcome.
And doctor, can you suggest some home remedies for our viewers for the sinusitis?
Yes, ma'am. So the old and typical home remedies are steam inhalation, first of all. In a bowl of hot water, either just the hot water steam you can breathe in and breathe out, or better with some Vicks or the Chinese axe oil like that, medicated oil you put and take steam inhalation 2 to 3 times a day. And definitely, as the ear, nose, throat are interconnected, that may, any allergy of the nose or sinusitis may affect the throat also. So warm water gargle is important, like half glass of hot water with 2 spoons of salt, and gargle just half minute. You do that gargle and spit out the water. You have to do this half an hour before food, which should be also helpful. And avoid cold food stuff, those also are important. When you are starting the symptoms, you try doing like this, it will reduce the symptoms. If it still aggravates, then you come to the hospital.
Okay. So doctor, are there any specific causes for the sinusitis?
Basically, the causative organisms are very commonly, you should say, it is all the dust. There are present the pollen grains, and those things only start the allergic reaction. Then it will be virus. Almost 90% of, or 80 to 90% of the causative organisms are viruses. And though it starts with the virus, immediately the bacteria will take over. So the remaining next another 15 to 20%, the bacteria are the main reason for that to proceed on with the infection. And there is a minute percentage of even fungus to get involved. So fungus are, though they are minor chances, but still they are very deadly.
Yes.
In this incident of this COVID pandemic, you must have heard that patients develop fungal infection of the sinuses, and which leads to immediate loss of eyesight and even death has occurred. It's called mucormycosis. So if that is identified, and that can be easily identified with the CT scan and also the local culture, if it is diagnosed immediately, as early as possible, the surgical intervention must be conducted. Then only they can save the patient. The mucormycosis will spread very fast and involve the eyes. The patient may lose eyesight, and very soon it will even end up in fatal death.
Okay.
Yeah. So that is the fungus part. Apart from that, mainly it is viral and bacterial. Yes.
Okay, doctor, what are the risk factors associated with sinusitis? Any other infections they can have along with sinusitis?
Sinusitis, as I told you, in ENT, ear, nose, throat are interrelated. So it can affect the ear, causing ear infection, perforation in the eardrum, causing ear discharge. That can occur. And then in the throat, it can affect the tonsils and the adenoids, and recurrent throat infection can occur. So if a patient is identified with the ear perforation, we call that chronic suppurative water dysmedia. If that condition is identified, directly you do the surgery and close the hole will not still help. The underlying factor or the source of infection is this sinusitis.
Okay.
So the sinusitis has to be first corrected, and then only once the patient is healthy, then after some 3 months or 6 months they can plan for the ear surgery. Similarly for the throat also. The infection can spread from ear to ear and throat, or from the other two places to the nose. So that has to be sorted, and the first primary infection should be corrected, then only the other infection should be corrected.
Okay. Another common query is, can we prevent sinusitis?
Okay. Definitely every disease has its own prevention, ma'am. I forgot to mention about one other cause for the sinusitis, smoking. Okay. So there when you ask about this, that yeah, even smoking also plays an important role in formation of this disease. So starting from precautions like keeping your room healthy, avoiding letting your child playing in a dusty area, avoiding the child to be with the sick patients, because the children develop infection fast from their from their colleagues. And then food habits, healthy food is necessary. So avoid the junk foods, avoid fast food items, avoid cold carbonated foodstuffs, ice cream, carbonated juice and things like that. And if the AC is too much cold, or if the climate is very cold, avoid going into this cold climatic environment, especially the early morning or late night. Those things and all will aggravate a lot. And most of the patients who have the sinusitis, if they take late night head shower and all, that again will aggravate. So those things and all have to be avoided. So definitely for all the diseases, there is prevention that we can try. So that will reduce the occurrence or aggravating of the disease. Like that.
So doctor, any advice from your side for our viewers?
Yeah, generally for the ENT, I would say that the ear, nose, throat, first of all, they are interlinked, and that's why there is a separate specialty of ENT. God has created and gifted us with a wonderful system, which is if we only protect it and not misuse it or abuse it, we will have a very healthy life, a healthy and happy life. So ear, nose, throat has to be protected in the sense, as I told you, avoid. Keep your room clean, that's the important thing. Keep your room, bedroom, study place, workplace clean, dust free, and avoid junk food, cold food stuff, unnecessary junk food and carbonated drinks you have to avoid. And don't use your finger or tissues and all too much to your ears, nose and throat and all. No, by putting that fingers, they themselves will cause infection. You might even develop swelling like pustules over there called furunculosis that can develop here in the nose or throat just because of we rubbing our ears. So like that also infection can start. And once you understand that you are becoming allergic, you have to avoid things which are causing the allergy. That is very important. And then I always advise my patients about the food habits. Like certain fruits and vegetables also make our body more cold, which indirectly it will again aggravate this allergic rhinitis and sinusitis symptoms. Those are the sour tasting fruits that are example lemon, orange, grapes, guava, pears, pomegranate, watermelon, Philippines banana, strawberry, kiwi, all these sorts of sour fruits. And then comes this vegetables, you have this okra, cucumber, radish and things like that, and laban. These things and all, you have to either avoid it or take in little quantity, especially in the lunchtime, not in the morning or night. And then even yogurt is actually good for the health, but it should not be old, it should not be cold also. Once the yogurt gets old, it will again get the sour taste. So these things and all will aggravate the sour tasting fruits and vegetables and the laban. They make your body more cold, and anything which makes your body more cold, the sinusitis will aggravate.
So whatever causes allergy, we have to avoid.
Yeah, by avoiding the things that are causing the allergy itself, you are more than 50% you are cured. The remaining 50% only you have to take, depends upon the medicines and treatment you are taking. So basically this sinusitis is starting from the allergy most of the time. Allergy cannot be cured, it can be controlled. So in the line of treatment, which I forgot to mention in the medical management, comes the steroid sprays. So that will give a long time benefit It is a very low dose of steroid which has to be used in the nose, just like only before going to bed. 2 puffs here, 2 puffs here. For adults and children, it's just 1 puff, 1 puff. You use that continuously for 1 month to 3 months as advised by the doctors. You will feel much better for a long period of time, and with the precautions that I have told, like avoiding cold foodstuff, dusty areas and all, the person will not have the recurrence for a very long time. If again they are thinking they are getting the symptoms, try with the anti-allergic medicine and the spray, the decongestant sprays. Again, in the decongestant spray, a lot of people go for this instant one, which one will relieve fast, but more than that, the sea salt water sprays are much safe for a long time. They will not have any side effects and all. Effect may be less, but very it's good for the nose. So like that they can treat, and the home remedies that I said, steam inhalation, warm saline gargle, avoid cold food, stuff like that. On top of that, if they are still having, again they can go to the doctor and evaluate, and probably he will come out with the same nasal spray. Again, you have to use for 1 month to 3 months and then take all these precautions, that's all.
Now you mentioned about the steroid sprays. Are there any side effects for them?
No. Generally, steroids are not supposed to be taken on and off and without any medical advice, and it is not good. You know, it has a lot of side effects like contraindications. But for the nasal spray, you don't have to worry because it is a very, very low dosage. It's the strength itself is like 0.0001 like that. So that is only for the topical use. It is not going to mix with your blood and all. It doesn't go to the systemic circulation. So that will just give a local effect, and which gives a very promising. And you take a spray today, the steroid spray, the effect your body will get after 2 weeks only. So that's slow the medicine is. That is why we say consistently you have to use for 1 month to 3 months, we say. If you use it for 3-4 days and you forget for 2-3 days, then again doctor told no, so again you take and use it, it will not give any benefit. Most of my patients, though they have been advised by the previous doctors to use this sprays, but they are all using like SOS medicine. SOS means you have headache, you take Panadol, headache goes, and next day you don't have to take Panadol. They are taking these steroid sprays like that, which will not at all affect, only the money is the waste. So these steroid sprays are safe. Take it to minimum 1 month to 3 months as advised by the doctor, and it has to be, should not be intermittent. It should be continuous. Should not even forget 1 day. 30 days one patient takes, 31st day he forgets means the 32nd day becomes the first dose again. Yeah, so that I take time and tell all my patients. So still more than 50% forget it and they come, no doctor, I forgot, like that.
Okay, doctor. Thank you for being with us. Thank you very much. This was a very informative episode. Thank you once again.
Thank you so much, ma'am.
So viewers, I hope this was a very informative episode. As doctor said, if you have the symptoms of sinusitis, go for medical intervention and take care of your health. Stay happy, stay healthy. This is Jasila Mujib signing off till we meet in yet another episode of BMC Global Live, Al Hilal Health World, nothing but lifestyle. Good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.